Let me get the mic. Honey, I got something to say. Ooh, I like that. Can you turn that up for me?
What's up? What's up? It's your girl Maj, and we are back with another episode of Eggs Maj, the podcast, where I am spilling all the real tea. Now, I am so excited because I have a special guest here with me today that's getting ready to drop some real gems. Multi-state licensed clinician, Dr. Cortina Peters is here with me today. Hello, Cortina. How are you? Thanks for joining the podcast today.
Thank you so much. Thank you so much. Actually, won't be doctor until October, but I'll take it early.
We'll take it early. We claiming it early. Yes. That is super exciting. And congratulations early to you on that.
Thank you.
So I'm really excited to dive into this conversation. And before we get started, I would like to say that this may be a trigger to some of our listeners. We are going to kind of talk about some deep things. So, at any point, if you feel triggered or uncomfortable, please cut us off. We'll I'm happy to have you on the next episode. But I totally understand that, these topics can be, triggering for a lot of people. But I'm excited, not necessarily in a happy way, but I'm excited to shed light in this arena, in this space, on these topics that are affecting, many of us. And I think it's so important that we create these types of spaces, to continue to have these conversations. So I really want to jump in. But we've seen, we're both Black women, right? And we've seen, depression, anxiety, and other similar mental health issues that have been really, really impacting our Black women. And I feel like now more than ever. What is the cause of this? What do you think is the driving force?
I think that's really multi-layered, right? Because when I was growing up, I can remember older women and individuals within the community saying, oh, Black people don't get depressed, right? And so if I grow up hearing that, I'm not going to be able to label or to describe exactly what it is that I'm feeling when it looks like depression, it sounds like depression, but Black people don't get it. So it must not be that. So I think one of the things that now we are now able and feel more at liberty and free and give ourselves permission to actually verbalize and say, you know what? Yeah, I'm depressed. That more people are now starting to listen. So that's just one part. We still have a very long way to go because it's still very much stigmatized, as we know. However, I do think that we are loosening the reins when it comes to our belief systems about the way Black individuals experience mental health challenges. So that's what I would say on that. I think it's historical. I think it's a mistrust of the system also, because it's almost like, okay, do I really trust these individuals to give me a diagnosis? Is that really what it is when we have so much medical mistrust within the system? So that's why I say I think it's very multi-layered when we are looking at what are some of the factors that go into all of these things that we are now seeing. At one point, it breaks my heart because not just Black women, but also Black individuals, period, are just like, okay, last month, someone took their life. This month, someone took their life. And on the outside, you would have absolutely no clue. That's why I tell individuals depression is definitely on a spectrum. Your depression may not look like my depression. And just because I can get up and go to work, just because I can pay the bills, just because I can take care of the kids, just because I make six figures and drive a nice luxury car, that does not take away from my ability to be depressed. You don't know what I'm feeling on the inside of myself. Outwardly, she looks fine. But on the inside, I might be dying or crumbling and no one knows.
Yeah. You know what? You're getting ahead here, and I'm so excited to dive into this because I think this is so important. But you kind of touched on some things that, we're gonna kind of dive into a little bit later. But, you talked about this mistrust, right, when it comes to diagnosis, right? And we all know those Black mamas and Black daddies who don't believe in mental health and depression because you don't pay no bills, right?
What you depressed about?
Well,
You
what
don't have
you
that
depressed
going on.
Oh my gosh, I can attest to that. No, but sorry, mama. But yeah. I really want to tap into what depression is, right? And so you mentioned a very important part where you said, it's on a spectrum, right? Like, so my depression might not look like your depression. So what is depression and how does it affect people?
So depression is a mood disorder that causes persistent feelings of sadness, loss of interest. And so some people, when they hear it, they hear like major depressive disorder or clinical depression. So those are the two terms interchangeable, where it's just a lack of interest, sadness, and these are persistent feelings. Not like, oh my God, my favorite character died on the show and now I'm sad. No, we're not talking about that. These are persistent, pervasive feelings that we have that affect and impact the way that we show up in the world. And so it can lead to a variety of other emotional and physical problems as well. For some individuals, where we call this, because you have like high functioning depression, and which is not really a thing, but it's more like a qualifier or descriptor to help people like be able to understand it better, because high functioning depression is not in the DSM. And for those of you who don't know what the DSM is, it's like the psychology Bible. Every disorder and diagnosis that we have is in the DSM-5 TR. So that is that Diagnostic Statistical Manual. That is what we go by. That's how we diagnose individuals with various disorders. But going back to what I was saying, where you have some people, they can't get out of bed, they don't have an appetite, they can't function and do their ADLs, and ADLs are activities of daily living. So they're just like the depressed person. What you think of when you hear someone say they're depressed, that's what most people think about. So if I am not exhibiting these characteristics, there is no way I can be depressed, which is not true. It's not true at all. And so I think it's going to be very important when it comes to spreading knowledge about how depression can affect different people in different ways. That's why I said it's on the spectrum. Sarah might not be able to get out of bed. Sally might be running a Fortune 500 company. They both can definitely be having or experiencing some of the same internal things on the inside.
Yeah. Oh, that's so good. And I want to jump into high functioning depression, right? Because that has become more prevalent, right? Like we hear that a lot. So I want to jump into that, but really quick, I know you talked about, depression being on a spectrum, right? And I love that you brought that up, so that, because it's a bit more understandable, especially for folks like me who don't understand this arena. What is the origin of depression? Is there, oh gosh, okay. I opened a can of worms.
So this is also multi-layered, right? You know how they say it's more than one way to skin a cat? Well, there's just not one reason for depression. It can be genetics, right? So research basically shows us that depression can run in families, which it does, right? So you can be genetically predisposed to experience depression, right? It can be your brain chemistry. There might be some neurotransmitters that are off, and we know neurotransmitters, they regulate the mood. So if my mood is not being regulated the way that maybe it's supposed to be regulated, I might experience some mood disturbances. Some of the other things is stress. That can definitely exacerbate how you experience mood changes, which lead to depression. Health, different types of hormones. You have something known as seasonal affective disorder, and that kind of happens like around the end of the year, like that October, November, December. It gets colder, also known as SAD. And so daylight and different types of seasons can cause people to feel a little bit like they have a lack of energy, and my mood cycles are different. Life events. You can have a traumatic event happen. Maybe you lost a loved one, right? Who was very significant to you. There are some individuals, they have, everything is going great in their life. Boom, I lost my child. Boom, I lost my husband. And I don't come out of that. Like I am now clinically depressed because my mood has changed. You have family and social environment that can cause depression, and also how we react to different situations, and that just comes from our personality. How do we manage and handle situations? So those are like all of the different types of layers and things that can contribute to who and when individuals may experience depression.
This is good. Oh my God, I'm learning so much. I love this conversation already. Okay, so going back to like, and I don't mean excited, like happy to talk. I'm like, this is so important to shed light on this. Like, you know, and as a Black woman, you know, people who, I'm a woman who has Black women friends, like who deal with these things. Like, so it's so important for me to shed light on this. So going back to high functioning depression. Right. Mm-hmm. And you said that ain't in the DSM. Okay. I know that. I know that term now. That's not in the DSM. So what is high functioning depression? Like how is it different? And so I think, you know, you made a good point about the girl that's the CEO that can still be depressed. Right. So I'm thinking about her, right? The CEO, the fine husband, the great job, the great salary, on Instagram, straight flexing. And she's I guess dealing with high functioning depression. Talk about that. What is that?
So basically, but they still have thoughts, right? So you have to understand that it could come and go sometimes. And so you have to think about it like this. If I am experiencing high function depression, I develop a negative pattern of unhealthy thoughts within my mind that kind of create a web of dysfunction and a web of dysfunctional thoughts. So it's like a cycle now. And so now I'm having these cycle of thoughts of hopelessness, helplessness, like it's not going to get better, but I have the energy enough because I can still go to work. And that's what causes us to lead to, unfortunately, ending up committing suicide, because it's like, I can't seem to get out of this web and this cycle of negative intrusive thoughts that are now in my mind. And so some of the things that they also experience, so like some of the symptoms, frequent tiredness. Well, guess what? I might be tired because I'm a high-powered CEO. So do I think it's coming from depression? No, because I don't acknowledge I have depression. I'm just tired because of my job. And it might go undiscovered. Avoiding social situations. They keep up the routine, but sometimes they'll disengage. They may say, you know what? Oh, I have to always talk to people all the time. You know what? I just want to stay in, which it makes sense on the outside, but is it isolation? Yeah. Am I withdrawing from maybe individuals who I'm normally used to okay being around? They have a little bit of extra irritability, which if you're in a position like that, and it doesn't even have to be in a position, you can have someone with, I'm going to say air quotes, high functioning depression who works at McDonald's or anywhere, right? If you're interacting with people and you don't identify that you are dealing with depression, you may say, oh, it's just the people. They get on my nerves. They're rude. You know, that is what is causing me to be more irritable than maybe what I normally am. Overeating, over-exercising, difficulty falling asleep, difficulty staying asleep, inability to focus. That sounds like a lot of us. If you like, oh yeah, it's difficult for me to for me to concentrate. But you also have to have like these negative thoughts about, are you feeling hopeless? Are you feeling helpless? Do you kind of what's the word I'm looking for? Not really have positive type of things to say about your future? Are you very pessimistic about what's to come in the future? And if you are more than likely often on the stage, like I'm speaking out or I'm cheering, like, the cheerleader, she was on stage performing, but those closest to her, what was her conversation like? Because somebody can be very different when you see them on the TV versus, oh, that's nothing. We may say, girl, you did great. No, it doesn't matter anyway. We have to watch for those subtle shifts in behaviors and moods. That's why I think it's so important and amazing that you're even doing this, so that individuals listening can get the information that they need about dispelling the myth in regards to what is depression.
Yeah.
Because if I'm not in the bed and I can't get up, oh, I'm not depressed. But you very well could be.
Yeah.
And not know it.
Yeah. Yeah. Oh, so many interesting points here. And you know, if in full transparency, right, in full authenticity, like I was that person that looked at other people, you know, on Instagram or even in person and saw the accolades, right, saw the accomplishments, and I thought, how in the world could they possibly be depressed, right? Like I linked, you know, you being successful to, there is no association there to depression, because how can you be depressed if you're successful, right? And then that's where that the high functioning piece came in, you know, that I started to learn about.
Yeah.
But you know, it really hit me when Cheslie Kryst committed suicide. God rest her soul. You know, and Cheslie was someone, I don't know her, obviously, but I felt like her. Like I felt like I could relate to her, like just her life. Like she was chasing her dreams, you know, she made her family proud. She was this pageant queen. She was Black. She flaunted her natural hair. I mean, she inspired, like, I remember this one, I can't remember what queen it was, but they posted a response that she was like responding to someone like saying something to her on Instagram. And I mean, it was so graceful, so poised. I mean, she like got them together, but it was so graceful. So I mean, like, and if you watch her video, she just seems like interviews, she just seems like this, oh my God, bubbly, like just perfect. And I hate to use the word perfect, but it just is like how, like she just has everything she could possibly ask for, right? And so then even thinking about the cheerleader, I think that you're talking about, Miss Arlana Miller, you know, who also committed suicide, God rest her soul, you know, but that really struck something in my mind. Like, okay, I don't know everything I think I know about this disorder. So when you think about, you know, Arlana, right, standing on that bridge, right? Or when you think about Cheslie, you know, standing on the 29th, you know, building of her apartment, what was like the last piece? What would you say really like led them there to say like, I can't do this anymore? Was
they
it
felt like I would say they felt like they had no way out. Like no one's gonna understand. People outside of me, they tell me how great I am. They tell me how beautiful I am. They tell me, oh my God, you've done all of these wonderful things, and nothing that I own, no title, no label, nothing can fill the emotional void that I feel.
Yeah.
There's no way out. So that's that hopelessness.
Yeah.
All hope is lost. And the only way that I know that I can stop the pain is by ending my life. Because if my life is not here, the pain will not be here. But the reality is, it doesn't matter if it's high functioning or low functioning.
Yeah.
If you think or feel, you don't have to know for sure. I would say even at the thought that, okay, my mood is shifting, ask for help. Go seek a professional who can help navigate you and help you walk through the emotional shifts, challenges, and changes that you may be or maybe about to experience, right? You might be going through it. You might be preparing for it. You might be supporting someone who's going through it. You have to make sure that you are asking for help without stigma attached to it or being embarrassed or feeling shame. You have to understand, in the Black community, and I do this a lot when I'm speaking, and I talk about women with the S on our chest, and society has taught us that, okay, well, Black women, we do this, we cook, we clean, we go to work, we make the dinner, we wash the clothes, we clean the house, we have 800 jobs, we get it done, we plan parties, we nurse babies, we do everything. That's great, but it's also an unrealistic depiction of what it means to be a woman or to just be. right? Just because you can do all of those things, you don't think that the women that were doing all of these things did not have some type of emotional response to all of this stuff that they were carrying. I had a patient one time and they were saying, oh my God, you know, like my mom did all this, blah, 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 blah. But when we really started talking about it, she was able to see that, oh my God, I think my mom was depressed, because she would do all of these things, but then she would go into her room and we wouldn't see her. So she would be at all the games. She would cook all the food, plan all the parties, do everything for all the kids, but then we wouldn't see her. So even if you could do it, why do it when you can ask for help?
Yeah.
It's not a race. It's not like we're going to get, oh my God, Superwoman of the Year award. So if you need help, ask for it, because we might be, the word I used earlier, exacerbating some of the emotional responses and putting ourselves in emotional situations that we don't even need to be in. When your body starts to tell you to stop, stop. When you need rest, rest.
Yeah.
If you need to ask, you know what, girl, I can't do this right now. And this is for men and women, not just for women. You know, you don't have to be everything to everyone.
Ciao. Right.
Because when you're doing that, how can you show up for you? And now you're carrying all of this. You're probably going to feel like no one understands. Now you're holding it all inside. That can lead to depression. But you still got to show up, because you still got these babies and you still got this job. So now you fall into the category, okay, high functioning depression, because she's still doing everything.
Yeah.
But she's dying on the inside.
Yeah. Yeah.
And a lot of times individuals who experience high functioning depression, they're overachievers. They're overachievers, type A personalities, or very high achievers. They've achieved a lot of things within their life. And even in everything that they've achieved, it's still not enough.
Yeah. Yeah. Wow.
And and because it's not necessarily a label as far as depression, they can hide very well. And even the closest people around them might not even know, oh my God, they were depressed. I never knew it. Never knew it. Just like transparency, I would say back in like 2013, I was definitely depressed, you know, and I was a clinician then, I was a therapist then. And I actually had to go on medication. Like no matter what was going on, but mine was life situation induced. My favorite cousin, we always dressed alike since we were little girls. I'm an only child. She was the only girl. We were like sisters. We were 2 months apart, and she died suddenly. My world was turned upside down. I still had to show up to work. I still had to take care of my daughter. She left behind a 5-year-old little girl, you know, so like I'm still functioning, but I would go home and just sleep. I would cry. I was tearful, but you would never know it at work.
Yeah. That's interesting. Thank you for sharing that too. And I'm glad you brought that up, right? Because I watched the Red Table Talk with Jada and Jada's mom and Willow and Chesley Crease's mom, who came on there. And I didn't see that one. Yeah, I loved Chesley. Like I followed her journey for so long. So that was so devastating to me, you know, to see her reach that point. And I'm like, I can only imagine what her family's going through. But I remember that was that time where all of the queens were Black, like the Miss Universe.
Yes, that year. Black, yes.
The Miss, like, I mean, it was Black girl magic all around. Like you couldn't tell me nothing. Okay, no, Miss USA is Black. You know, but during, oh my God, and I encourage you, like if it's not a trigger for you, like watch it. It was very sad, but very beautiful. It was a very beautiful interview for her mom to talk about that. But her mom did kind of talk about the last message that Chesley sent her right before she committed suicide. And so I think one thing that really stuck out to me, and I asked this because I don't understand it, but one thing that really stuck out to me, and you mentioned this, you talked about, you know, hopelessness, and you also talked about kind of going to work and still being like high functioning, I guess. But she never mentioned in the message that she lived a horrible life, that she was, going through, some sort of tragedy. She just talked about that loneliness, like that hopelessness, those voices, in her head that were telling her, that she wasn't
those
enough.
negative thoughts.
Right. And so I guess, and I know we talked about kind of the origin and how, depression is on a spectrum, but I guess for those people like me, like for those who are listening and for me, for people who don't understand, like what just, I guess, drives her to that point. She had a support system, right? Like she had, like
it
I guess,
appeared, but that it appeared, right?
Okay.
Just because it looks like a support system, if I don't find it supportive, maybe it was supportive to an extent, but the type of support I needed, they were unable to give it to me, not because they didn't want to, but because they were unaware that I needed it.
So it's go ahead.
So a lot of things can appear to be a lot of ways. Like I had to correct someone. They were like, oh my God, but she was so pretty. I said, mental illness does not discriminate. I don't care what you look like. It that doesn't matter. And that's another stigma or myth that people have, that people who have pretty privilege don't feel depressed. Again, going back to like our moms, what they used to say is, well, you don't have nothing to be depressed about. You're not out here struggling. Like, no, but I am. Just because I have everything that it looks good emotionally. No, I didn't have a horrible life. Yes, I may have been privileged, all of these different things. And remember I told you the cycle of the dysfunctional thoughts that are in my mind, that has nothing to do with my upbringing or what I have or what I've achieved. It absolutely has nothing to do with that, and everything to do with, what is my mind telling me? What are the narratives going on? My feelings of hopelessness got the best of me. And there was no coming back from that. That's why I said the best course of action is early diagnosis or treatment, not waiting till it gets to a point of no return. That's why I said, even if you suspect, oh, this is different, I'm feeling something different, ask for help. Go talk to a professional to help you navigate through it. Don't be afraid to ask for help out of fear that you're going to appear weak.
Yeah. Ooh, yeah. So I think my takeaway here is that those dysfunctional thoughts are not necessarily linked to something happening in your life.
Correct.
Got it. Okay. Whether
Correct.
it's good or bad.
Correct.
So in other words, you can have the whole world, but if those thoughts are telling you something different, then it doesn't matter.
It's almost like someone who's super skinny and they're like, oh, I got to lose weight. Yeah. Everybody and their mama and Jesus can come down here and say, girl, you look great. But in her mind, if she does not look great and she want to lose 10 more pounds, there's nothing you or anybody else can say that's going to change the thoughts that are in the mind.
Yes. Got it. And I hope y'all are listening. I hope y'all got that too, because I grasped that real good. So you talked about like the early diagnosis, right? Like, getting it early, getting help early. But you also mentioned something about, not having to support that, how can I put it? Not having to support the way you want the support or with the way you think you should have the support. So for those who are dealing with depression, who are suffering from depression. So when we think back to, Chesley, or we think back to, Arlana, when it comes to seeking help, what does accountability look like on their end for them?
For the individual?
Yes.
Okay. So again, going back to when I was saying, if you feel something is wrong, say, like, ask for help. Become educated on, okay, let me figure out what's wrong because I don't want to be this way. There are some people also who have a fear of people gonna think I'm crazy or medication, right? They might not want to get on medication, right? I'm not a proponent for medication or anything like that. However, there are some things that talk therapy can't get you through. And the best case scenario is a combination of talk therapy and medication. It's not something that you're going to be addicted to, and you might not even be on it for the rest of your life. But until you can get a whole and a sturdy foundation emotionally so that you can grasp the concepts that you are discussing and learning within the therapeutic sessions, that might be beneficial. Like I said earlier, I'm a therapist, and I was like, look, I ain't never thought like this. I'd never thought that this would be me. Yeah. But even though I can do all of the coping mechanisms and skills in the world, but I needed something more than what I was able to give myself. And you got to know, if you're not even aware of that, because, you know, most people don't have as much knowledge as it relates to how am I getting over this than me. Yeah, you might need more help than maybe what you've even thought of before. Talking to someone who you trust and asking for an accountability, I call them accountability buddies. So an accountability buddy would be able to be someone who you trust when you start to wax and wane. And if my mood starts to shift, if you see me getting a little bit more irritable, you know, tap me on my shoulder and be like, all right, girl, okay, I'm seeing this. All right.
Girl, you getting on my nerves.
You good? Like, we need to reset.
Yeah.
If your life is very busy, sometimes your emotions can get away from you. Sometimes you have to take a break. You have to reset, regroup, refocus so that you can have a good pulse on what are my emotions doing right now? Where are they? And so those are some of the things that I would say that you can do to be accountable for your emotional wellness so that it doesn't get to the point to where you feel as though my only way out is by ending my life.
Yeah, that's good. You know, and I asked that because I feel like anytime we see news of suicide, right? Like the first thing people say is what? Check on your strong friends. And I wanted to mention accountability because I felt like checking on your strong friends doesn't work if your strong friends don't tell you what's going on.
I think strong is also very subjective. I can be successful, but that doesn't equate to strong.
Strong, yes.
So we have to change the verbiage when we say check on your strong friends. What does that mean? Does that mean check on your successful friends? Check on your friends that look like they have it all together? Check, like, okay, I think all my friends are strong, but some go through different things in their life, right? And so what does that mean? We all not just check on your strong friends because something happened, but that should be a practice that we are doing and implementing so that we have a pulse on, I know this what you're saying, but we still gonna go ahead and take a day just for all of us. You really good? And I even tell myself, I tell people all the time, I am like, please be a low maintenance friend because I can't be calling and doing all this because my life is crazy and busy and everything like that. But there are some times when people drop in my spirit and I'm like, you know what, let me check on them. Or maybe they said something to me, or maybe I had a dream. It just is that motivator for me to call them. That same cousin that I said earlier that passed away, I was doing something and it was like midnight and I was like, oh, I need to call her. She died the next day. That was I had this thing. I was like, something's telling me to call her. And I called her and I was like, girl, is your brother still getting married? I'm talking about like the craziest thing. I was like, oh, you're sleeping? She was like, yeah, I'm not feeling well. I have a headache. I was like, okay, I'll talk to you tomorrow. And 12 hours later, my mom was calling me, telling me they were rushing her to the hospital. So when you get these pulls, you know how sometimes you'd be like, oh, I was just thinking about somebody the other day. It take a minute to send a text. You can follow back up with a phone call, but when something or someone is on your heart, reach out to them. Yeah. Because I really believe in energies. Like people's energies are strong. And if you're close to someone, sometimes you do feel something. You might not know what, but if that person's name or you think about them, send them a text.
Yeah, that's good. That's good. I like that. Now, you know, we talked about, right, like accountability on, you know, the parts of those who are suffering, you know, from depression or anxiety. But on our side, right? So when we think of friends and families, like how can we be allies and help those people who we love that may be suffering with depression? Like, is there a way to stop them from getting to that point? Like, how do we hold ourselves accountable?
well, I don't know if it's we ain't God.
Right,
so we
right,
can't stop
right.
it. But we might be able to mitigate some of the development of what they may have. One of the biggest things is don't minimize when people say, girl, I'm stressed. You know, you may mean nothing by it by saying, girl, you don't got nothing to stress about. You got a husband, you good, you got money. Like, I'm the one that's over here stressed. Don't do that, because you invalidate their feelings. So next time I want to share with you maybe what I'm going through, I'm not, because you're not going to take me serious. So don't invalidate anyone's feelings or minimize what they might be going through just because you don't understand it.
That's good.
Because when someone comes to you, it's not about you, it's about them.
Right, right.
And so that's probably one of the biggest things. And support.
Yeah. If
they need help, what's going to be the most beneficial way that I can be supportive?
Yeah. Now in that same spirit, right? And I think, this might help me a lot. But if someone comes to you and they say, my friend, family, siblings, I'm depressed, or I think I'm depressed, what do you say? What do you do? What should be your response?
Go to Therapy for Black Girls and find a clinician.
Okay. Mm-hmm.
It's whatever you can sort, whatever you're looking for, whatever state, whatever insurance. You can read their bios. They all look like us. Yeah. So I would say go to Therapy for Black Girls and see someone immediately.
Yeah. Okay. And
that's the first step.
That's the first step.
Or find Black male therapists if you're a male.
Okay. That works. Okay. Now in that same spirit, what are some other resources that folks can utilize who may be suffering from depression?
NAMI, NAMI, National Alliance for Mental Health. You can contact them, any of your local offices, as it relates to mental health issues. You have SAMHSA, Substance Abuse, Substance Abuse and Mental Health Association. all these acronyms, yes. So you have SAMHSA. So these are all like the national bodies or associations where you can go to, and they have a myriad. Just type in where you live and a list of providers and resources, depending on what it is, whether it's substance abuse, domestic violence, homelessness, whatever it is, will come out. The suicide, hotline, you can contact them if you are contemplating ending your life.
Yeah, that's good. All right, Ms. Cortina, well, tell us where we can find you, follow your journey, learn more about you. And if we want you to be our therapist, what do we need to do?
So I'm licensed in 4 states. I'm licensed in Florida, Georgia, Texas, and Wisconsin. So if you reside in any of those states, I am able to see you. You can follow me at The Girlfriend Therapist on Facebook and Instagram. And you can also follow my center, the Noir Center for Intuitive Healing and Counseling. And it's an Afrocentric, where Afrocentric roots meets the luxury of emotional and mental wellness. So that is a center and a space that I created for Black and Brown people to feel safe. We honor your story and curate your legacy to help you be able to flourish at your optimum potential. And so that is at the Noir Center. So Noir is Noir. So the Noir Center.
Love it. I need to go on and follow, because I follow every other page. I need to follow that one too. But Cortina, thank you so much. Like, this has been so helpful, so informational, so valuable just for me. And I have so many friends, family members, siblings, who deal with this, and it's just not something that we understand, right? And it's so important that we take, those steps to be accountable and make sure that we understand so that we can have the right response. We know how to help to, try our best to mitigate these things from getting too far. And so, like I said, it really touched my heart, when Cheslie Kryst took her life, because I saw, so much of myself in her. And then to, watch her mom talk with, Jada and her family was just so sad, but so powerful, you know, and
Yeah.
I wanted to keep that conversation kind of going because, you know, I think a lot of Black women may be dealing with this and don't know that they are, or
Yes.
they may have friends who are dealing with it and they don't know how to respond,
Help
right?
them. Mhm.
Or, yeah, or help. So this has been so helpful. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Oh, you're welcome.
Yes, and y'all make sure y'all go follow Miss Cortina. Honey, she's the bomb.com. Okay, girlfriend therapist at your service. I love
Yes.
it. Love it, love it, love it. Well, thank you so much. And thank you to all my listeners for listening to Ask Marsha podcast. Thank you for tuning in with us. And yeah, we'll see you on the next episode. Peace.